Hey everyone, it's Becky Enright again. So I just wanted to add some pieces of information to the discussion that we had yesterday, delve into the coronavirus a little bit further, and also talk about more than just the physical health impact of this new virus. So to start, the coronavirus is a new virus. It has not been seen before that we are aware of. So it's a new strain, which makes it that much more potent. What I mean by that is we are much easier to transmit this disease. With past viruses like influenza, we have built things or manufactured things like vaccines. Vaccines help not only provide that person immunity who's received the vaccine, but also helps with something like herd immunity, which is for the better of the community for those who cannot be vaccinated for one reason or another. It helps to slow the transmission of the disease, thus making less people infected all at once. So that's kind of why this is spreading much quicker than any previous strains, is because it's more infectious, it's more virulent, its RNA is duplicating, and right now we have no way to kind of slow that down through vaccines or herd immunity. So right now, it's really difficult to focus on the numbers and get an accurate depiction of how many people have actually been infected. And that's for a couple of different reasons. So the first reason being, as of right now, there's not enough testing kits available to test everyone with symptoms. So we are somewhat picking and choosing the sickest of the sick to receive those testing kits, and they're not available in all sites as of yet. So we're somewhat using clinical judgment. Now, even for a trained professional, it's hard to distinguish between different viruses such as COVID-19 and influenza. So in the general population, if you are testing positive for other respiratory illnesses such as influenza, we are assuming that you have that and not COVID-19. However, if you are testing negative for influenza and your symptoms cannot be better explained by any other known virus, then we are assuming that you actually have COVID-19 in most circumstances. So a lot of people are saying, well, can't we screen? Coming to my provider for a test. A lot of places don't have the testing kits on hand because they haven't ramped up distribution of those because this is such a new thing. So we're doing the best that we can as far as using medical decision making to triage patients. And again, that's why we're advising the healthy patients to stay home. The patients that if they have and meet all the criteria of the coronavirus, which if you recall is the temperature, so essentially fever, shortness of breath, and cough, when the cough is most notably dry, and you're doing okay with those things, meaning your body's fighting it off on its own, that's why we're asking you folks to stay home and reserving our medical facilities and resources for the folks that aren't doing well, that are their immune systems are not fighting this virus off, because those are the ones that may need critical medical care. And then, of course, we're giving the advice also that, if your condition worsens, then it is appropriate to seek medical attention. And that's, the absolute truth. So resource conservation is something that we're looking at here. And that brings us back to social distancing. Social distancing is so important because it is helping to slow the distribution curve of this virus. So what we are seeing is a curve that goes up and in theory will come down somewhat quickly. We're hoping to somewhat slow that so that there are more available resources in things like hospitals, and ventilators is one of the things I'm speaking regarding, but also personal protective equipment, which is known as PPE in the health professions, and that's things to protect our staff that are taking care of sick people. It's also to help our sanitation workers, to help our policemen, to help our firefighters, to help anyone who has a job description and needs to be out in the public performing their service. So we do need to look at conserving resources. And the more healthy people we have coming out or into our offices, the more resources that we are utilizing. So I hope that kind of helps to clear things up. We understand that you have needs as well, but in the long run, if you become ill, we want to make sure that we have the resources to treat as many people as possible appropriately. So many people think that maybe social distancing and school closures and canceling of events was being way over responsive or somewhat of an overreaction. However, again, we're not in the position to make those decisions. And based on what we've seen as far as presumptive cases and confirmed cases, I mean, those numbers are only going to continue to rise. And in all actuality, the numbers are probably not accurately depicting the amount of people who actually have had the virus or do have the virus. So I want to talk a little bit now, since we've talked about how to conserve resources, why we're asking you to stay home, and just talk a little bit about how social distancing does not mean social isolation. I have a great social work friend who really felt that that was important to say, and she's totally right. Now more than ever, people are going to need the support of friends and family and personal acquaintances. Lots and lots of people are going through a rough time, maybe if not physically, emotionally, and mentally, possibly financially. And depending on what type of faith or what higher belief you have, likely spiritually. So it's best to look at the whole person in general to see how we can best help them. So I'm encouraging those who are really struggling. There are 1-800 numbers available. Your provider likely has contact or numbers for counselors or social services. And all of those things are appropriate to reach out to at this time. Please use the resources available. And again, lift up your community members. Try to unify, to make good for the community. So I think during this reset, remember that's what I like to call it, it's important to focus on self-health and well-being. More than likely, you have a little bit of extra time on your hands with being home, and you're able to maybe get back to things like meditation or journaling or walking or eating better. Maybe we have a little bit more time to meal prep, and all of those are going to contribute to your overall health. They're going to help you stay healthy longer, and the healthier you are, the better chance you have of fighting the virus. The other thing I want to kind of touch on is the difficulty that our economy has had and will continue to have throughout the course of this virus, and how we can maybe think about our local restaurants, our local boutiques, our local shops, coffee shops, businesses, etc. And there's a couple of things that I thought of to help stimulate the economy for those who are financially stable and can do so during this time. And that would be to consider tipping wait staff that maybe you wouldn't normally tip for takeout. To purchase takeout or go to a coffee shop drive-through window if they're still open that maybe you don't typically frequent. So think small businesses, because those are the businesses that are going to be hurting the most during this time. Consider purchasing gifts in advance for events that might be coming up. Maybe you can get a gift card from a local clothing store or a local restaurant for a loved one who has an upcoming birthday. So just really try to think small scale and support, again, those members in your community, friends and family who might need the support the most during this time. I want to, again, leave with a note of positivity, and that is that this is all temporary, but the precautions that everyone is taking are necessary. So I thank you for your earnestness in trying to stay home with the social distancing. I hope that you get back to yourself, get back to well-being, the important things in life like friends and family, and also for those who do have birthdays in March and April, I want to let everyone know that I think it's reasonable to get that birthday week at a later time this year. If anyone knows me, the birthday week is pretty much the most important time of the year. So you have not been forgotten. So don't forget, friends and family, wash your hands. We'll see you soon.